Vestibular deficits and postural control. Patients with chronic bilateral vestibular deficits do not exhibit abnormalities in their postural responses to perturbations of upright stance. Thus, vestibular inputs are not essential for triggering postural reactions to body displacement. Researchers demonstrated that even in patients with complete bilateral vestibular loss, an upward tilt of the supporting platform could still elicit activation of ankle and neck muscles within the first 150 milliseconds following backward tilt. In these patients, the latency of postural reflexes remains normal, though their amplitude is reduced. These observations indicate that vestibulospinal input is not required to initiate a postural response but instead contributes to modulating its magnitude. Although the vestibulospinal system typically has very low gain when standing on a firm surface, patients with acute unilateral lesions exhibit body sway predominantly directed toward the affected labyrinth. This instability arises from an imbalance in labyrinthine inputs between the right and left inner ears to the vestibular nuclei, disrupting vestibulospinal reflexes. Additionally, the instability may stem from impaired vestibular signaling to the central nervous system, which distorts information about head movements and compromises the accurate interpretation of visual and somatosensory cues for orientation. When patients with unilateral vestibular deficits experience predictable balance perturbations, such as those induced by a platform moving continuously in an anterior-posterior direction, their body displacement exceeds that of healthy individuals. However, under both eyes open and eyes closed conditions, their overall pattern of body displacement resembles that of healthy subjects. This finding highlights the significant role of anticipatory postural adjustments, APAs, in this task and suggests that intact vestibular input is not necessary for generating appropriate APAs. Patients with bilateral vestibular deficits compensate for their impairment by increasing somatosensory loop gain, illustrating how the nervous system adapts by relying on remaining sensory inputs. Nevertheless, these patients may still experience instability when other sensory inputs are altered or during various motor tasks and postures encountered in daily life, such as adopting unusual positions or performing head or body movements.